Dear friends, Mr. Chairman, my talk on soft skills and training of the healthcare providers to treat elderly. Elderly population, when we look, there is a dramatic increase in the number, in the life expectancy of the people, and the number of the elderly persons are increasing exponentially from 77 million, 100 million, they form nearly 9% of the total population. So our country itself is becoming a graying nation. Growing old is one of the most difficult chapters in the great art of living, and more are destined to live long, and they have to gain knowledge of growing old gracefully. So aging itself is the only available way to live a long time. So there is an urgency to address the health issues of this growing mass of population as a separate segment. So in advancing years, the age-related disabilities, they require special medical attention. We have to remember that there are no diseases of the aged, but simply diseases among the aged. So traditionally, the giant families used to care, and the rapid urbanization that has taken place in the country, the exodus of the people from rural to urban areas, from urban to foreign lands, so it has resulted in a dissolution of the giant family and creation of an empty nest syndrome. So there is no support from the family or the community to the elders, and life has to be put into a great hardship to those people. So there is a decline in the function of the organs and also the various systems. There is an alteration in the anatomical structure. The age-related disabilities begin to appear. The mobility, hearing, eyesight, the memory, nerve conduction, declined immunity, increased vulnerability, infection, all these problems the elderly individuals face. So a proper healthy diet, regular exercise, social and intellectual stimulation, it can definitely help them to prevent or delay the onset of the disease and disability. So there is a susceptible to the same disease, these individuals, to which the middle-aged individuals suffer. So there are conditions like diabetes, ischemic heart disease, cerebrovascular disease, cancer, and all other disease. They fall from fractures. Care of the elderly itself has become really complex, and they have to live rather than die from the chronic disorders of the advancing age. So effective management of them to enable them to enjoy the later years as functional, active, independent members of the society, that is our main aim. So the care of the definitely requires a multidisciplinary approach, which itself is important in that the healthcare providers play an important role. They have either formal training or no formal training to take care of them. So in a vast country like this, where 72% of the people are living in the rural areas, they have definitely the individuals who are taking care, they have to acquire the soft skills and the training. So when we say soft skills, they are the interpersonal and social skills in caring and the professional relationship with the patient, communication skills, professional and ethical attitudes, and they could be acquired by them or they could be taught, and they have to develop as a part of lifelong learning and through the observation. That is the most important way to learn. So observing the teachers who become the role models, interplay between what has been taught formally and what is being practiced like hands-on experience and interaction. So the skills themselves are attained over a period of time by following examples and by experience, which is gained by trial and error. So the soft skills, what are those things? Important things are the values and virtues consist empathy, compassion, attentiveness, courage. Neither they can be taught easily, nor they would be developed in a clinical factory. So these soft skills themselves are acquired by watching others and actually performing them, and teaching to include medical ethics, demonstrating the humanistic aspects of the patient, the care, the role modeling professional behavior, and learning to see the patient as an individual. So Lynn Peters Adler in the National Centenarian Awareness Project, they have made how to the influence aging of the disease. They say positive but realist attitude the people have to develop, the love of life, sense of humor, spirituality, courage, and ability to accept the losses that come along with the age. So the soft skills themselves consist of a cluster of personality trait, social grace, commitment, language, personal habits, friendliness and options which characterize the relationship with the others. So they are complementing with the hard skills which are occupational requirements of an activity. They are personal attributes that enhance the individual interaction, their occupation and their performance. So the hard skills themselves are a set of abilities to perform a certain type of task, whereas the soft skills themselves are a person's ability to interact effectively with the persons under his or her care. So the special needs and requirements of the elderly care itself is a fulfillment of special needs, and it requires that required by the aged involves assisted living, management of the chronic diseases, long-term care, and it deals with the social and the personal requirements of the aged who need help and assistance in their daily activities and their health care. So the compassionate doctor themselves, many times we are seeing these people, their patients complain, the doctor themselves is rude, they don't listen, they have no time, they don't explain, and in an understandable way, their lack of communication, it causes frustration to the patients and affects the quality care. So the requirement itself, a compassionate doctor and a caregiver, the greater emphasis is on etiquette-based medicine, so they have to teach good manners in the interest and the humanity. So there were two people called Tench. It gave a cartoon in 1884 where two ladies were talking. What sort of a doctor he is? One lady asked. The other lady said, I do not know very much about his ability, but he has got very good bedside manner. So that's how she liked. To see, the training itself is to see a patient as a person, not as a bunch of diseases. And sympathetic, caring manner is therapeutic itself. It's itself as a treatment. The patient care has to be built on the base of good manners. So Theodore Billroth has said, he who combines the knowledge of physiology and surgery in addition to the artistic side of his subject reaches the highest ideals of medicine. So the etiquette-based medicine, which improves the behavior, it develops character, it brings professionalism to the career and satisfaction to the patient. So they are able to bring about a great bond of faith and a trust between the patient and the caregiver. They acquire skills in talking with the patient and show a compassion and empathy. So the healthcare provider itself must be a listener to the patient, helps in knowing the ailment properly, he can follow the regimen properly if understands, and otherwise poor outcome and complications are bound to occur. So good communication helps to adhere to the recommended treatment and manage the disease, which definitely improves the outcome in a chronic disease. So adherence to the treatment is very important. High risk of non-adherence among patients who provide communication poorly. So get a training in communicating skills, and success is determined by the adherence to the prescribed treatment, and any deviation brings down the clinical benefits. Good medical practice itself has been formulated duties which have to be followed to exhibit the professional behavior, the care of the patient, the protection and the promotion of health of the patients. It offers good standard treatment of care, updating the professional knowledge, skills, treatment of patient as individuals, respecting the dignity and maintaining their confidentiality. So the adherence of the treatment is more important. Good communication definitely helps. There are hurdles for the patients to continue treatment for chronic disease for long time, especially elderly. So poor adherence itself is a big hurdle to achieve better outcome for the patients. It is a common problem faced by the healthcare system. The roadblocks continue for treatment for chronic disease and primary prevention. So non-adherence itself affects the quality and length of life, damages the target and the premature organs and cause premature death. Financial constraints and the economic status definitely will apply. So the improved adherence definitely is important in these individuals. There are multiple disciplinary approach which itself has to be done in the 5 dimensions: patient-related factors, therapy-related factors, condition-related, social and economic factors, health system and healthcare system-related factors. So the patient education itself plays a key intervention to improve the adherence. So the healthcare providers, which are the important members of the healthcare team, They often have high level experience and ability, but do not require extensive healthcare training to practice profession to have high level of manual dexterity and good personal interpersonal communication skills. So they have to undergo some formal education like apprenticeship, job training. They must know body mechanics, anatomy, physiology, nutrition, infection control, cognitive impairment, mental health issues, personal skills and record keeping. So observing, documenting and reporting the clinical and treatment information including patient's behavior changes, taking, recording pulse, respiration, temperature, blood pressure, body weight, assisting personal hygiene with food, fluid intake, ambulating, mobilization of the patients, collecting specimens for the medical tests, providing emotional support. So one of the example being Alzheimer's disease, how they take. So the training itself, many may not have received formal recognized training within a defined curriculum from the institution. They will follow the doctors, gain knowledge and experience with skills, make patients adhere to the clinical guidelines and bring about the patient satisfaction. Standing in the community and the family also plays an important role, social and cultural advantage. So the training itself extend a helping hand to a poor population, provide services in an affordable and convenient way. Many no means of travel and taking costly medication. So the para-professionals assist individuals with physical disability. They provide health care which is needed with activities of daily living. Such a training course definitely can be undertaken. Learning objectives, the proper care of the elderly, and the achievement itself is maintenance of self-care, prevention of complication of aging, and delaying the decline and achieve better quality of life. So the healthcare provider definitely plays an important role in caring the elder, and it bring about the crucial role in educating the patients. Thank you.
Thank you. Since we are running short of time, I think there is no time for any more questions. Thank you, Dr. Shankar.
Thank you, Dr. Shankar. We'd like to honor Dr. Shankar for sharing his words with us this evening. Let's give him a round of applause once again.